Hello, amazing listeners. Welcome to another episode of the Boo Business Podcast, the unscripted show where we unveil, demystify some of the confusing parts of birth, breastfeeding, and infant care during the first year of life while having a little fun. I'm your host, Naomi Catron, registered nurse and board-certified lactation consultant. Our mission here is simple: to foster collaboration in maternal-child health and empower both families and businesses alike. We're all about creating a community where everyone feels supported and informed. In each episode, we dive deep into engaging discussions that span the entire spectrum of birth through the first year. From newborn feeding, because let's face it, it's something we all have got questions about, to tackling issues like tongue ties, the mysteries of pacifiers, mental health, bodywork, and just so much more. So whether you're a new parent navigating the incredible journey of early parenthood or a seasoned professional in the birth business, this podcast is your go-to source for laughter, knowledge, and some great insights. So we're here to make learning about boob business not just informative, but enjoyable. So join us for conversations that not only spark your curiosity, but also bring a smile to your face. So remember, every episode is a chance to connect, learn, and share. So hit the subscribe button and let's embark on this exciting journey together. Hey, Dr. Stephanie, thank you so much for being on the show. How are you doing?
I'm great. Thanks for having me.
It's a pleasure. We just finished a day of seeing babies together, so that's always nice. And now we're hopping on to do this quick episode because I've noticed so many families come in and they say, oh, I didn't know that chiropractic care can help with that. And I figured, hey, let's talk about that today. So maybe before we jump into that, can you tell our audience a little bit about who you are, what you do, and your background in this birth world?
All right. So I have I'm a chiropractor with a specialization in babies, prenatal care, and postpartum. But all three I love the most. I don't really see a lot of men, but I've been in practice for 10 years. I had the opportunity in the third year of my practice to go out to Raleigh, and I worked at a very busy prenatal and pediatric practice out there, and I did that for about a year. And then what I saw there was just how difficult it is for moms to they're always stressed out. They're overwhelmed. They have so much going on. So I really wanted to hone in and bring that back to Texas and hone in taking care of moms. And a lot of what I do in my own practice is in-home care to make it as easy as possible on moms to have chiropractic care in the least stressful way. And what I love about us working here at Milk Diva is that it's a one-stop shop for lactation, dentist, and chiropractic, and PTs here. I mean, we just have such a great team. I love having such a great team to refer to. I love collaborative care. So I like staying in my lane and knowing who the experts are in the other lanes and people I trust to take care of my patients, because I'm protective of them and I don't want to send them to just anybody. So I love our team here, and I love,
that's a good little results. I guess I take it for granted that people don't realize. They may not know our setup, so I should probably explain that a little bit. Okay. So Dr. Stephanie was a chiropractor that I met when I was doing home visits just doing home visits for lactation. I was a little bit newer in my practice, and a lot of my patients would go, I would refer them to chiropractic care, and she, in her private practice called Homebody, would be taking care of them, and then I would see really great results. And then one day I had this patient who lived in Bertram, right?
Yeah, they live
somewhere far.
Like Horseshoe Bay or Marble Falls.
Something like that. And she came into my office, and while she was there, Dr. Steph asked, is it okay if she wants to do a chiropractic adjustment too? Can I come in a few minutes earlier, adjust the baby, and then you guys do your lactation visit? And I was like, oh, that's a great idea. The baby was crying and screaming and was having feeding difficulties. It was this mom's second or third baby. The suck was super unorganized and having difficulty transferring, but I did not see a visual tongue tie. And so I was like, what is going on? So the baby was crying. I'm trying to be helpful. I put a glove on and have the baby latched to my finger. It was a very loose and disorganized suck. but I was trying to just help the baby stop crying so Dr. Steph can do her adjustment. And all of a sudden, the suck got really organized. And I was like, whoa, his suck is so much better. What did you do? And she was like, oh, I adjusted his sacrum. And then you said, it doesn't always happen like that. Like, you're trying to really explain to me, like, this is not a magic switch that just, babies don't always respond that well. This is just like a good example. But I mean, it don't expect it to be that quick always, Naomi.
It can. Like, there are certain things that I like when I am working with a baby and like the parents are right there. I want the parents to see everything that I'm seeing, because an adjustment on a baby looks like nothing. It looks like a little baby massage. Like, I'm just touching the baby. And so I like for them to see before and afters of little measurable things that we do. So it's not just, thank you for giving me your baby. I'm going to touch this baby and then hand it back. So there are some things that do improve during the adjustment that I can point out, almost always. But big things like that, like going from a disorganized suck to an organized suck during the adjustment, that I cannot guarantee in one adjustment. But that baby that I remember, it was not the first adjustment.
Right.
That's true. We had been building and correcting, and I was adjusting that baby's sacrum, which is connected to the rest of the spine, and specifically the cranium, which I love to work on. And so that's why it improved her suck.
I was so impressed because I was a little bit kind of like, this sounds a little woo-woo, right? Because I'm a nurse first, and I'm like, I don't know about this. What does this chiropractor have to do with tongue tie or suck? And so that was kind of a while ago. The point of the story is, through the years, I've had so many patients just have significantly positive experiences working with you, that you then started taking care of my family. And I was like, I really want to add chiropractic to the clinic, because I think it could be so beneficial to our patients, because they're driving all over town to do all these appointments. If they're already here to see us for lactation, wouldn't it be cool to do chiropractic care too? But I want someone who specializes in moms and babies. Yeah. And then you were like, well, depending how much of a commitment you need, I might be able to help you out. And so you're here on Fridays, and it's been so amazing because I get to see and learn so much more. And that actually brings me to this cool thing. I'm really proud. If you guys are listening to this on the podcast, you can't see this, but if you're watching on YouTube, we have a published article in this Pathways magazine, issue number 84. And it's, I don't know what page it's on. Let me find it. But it talks about
58
basically
58 or something like that.
Yeah, 54. Okay. So this is, my mic is in the way. Improving, what does it say? I can't remember. Improving infant feeding through collaborative care. Yeah. And so there's me, you, Dr. Poplin, and Dr. Britt that are authors on this article. And I'm so proud of you guys. We all work together. And these are all our pretty little faces. Oh, you can't see us because we're kind of, anyway. But this article is a great, I'll try to put a link in the show notes. And it kind of talks about how we have been able to care for patients and help prevent unnecessary procedures, meaning to say tongue tie releases. And so I listened to another podcast earlier, and Dr. Allie Goodwin was on, and she was talking about how a lot of the times she will do cranial chiropractic. How do you say it? Chiropractic
adjustment?
But she called it cranial chiropractic.
Yeah,
that was like the term she used.
When at the time I learned from two doctors, Dr. Wells, when I was in chiropractic school, he taught a technique called SOT, irrelevant, but I loved the technique, and part of what he taught was cranial, but that was just like a touch in class, but he went in depth in his office hours. And for me, I started chiropractic care because I was a headache person. I almost always had a headache. And the cranial adjustment, the cranial work was miracle working for me. So I would go to the office hours all the time to really hone in on cranial work. And then I was able to apply that to my pediatric training. And then Dr. Martin Rosen incredible cranial doc. He worked with the ICPA, who publishes that Pathways magazine.
That magazine, okay.
The ICPA is the International Chiropractic Pediatric Association. So that's who Dr. Brittany and I and Dr. Ellie, that's where we get our training mostly for pediatric and prenatal care and postpartum. Because we don't get a lot of that in school. You have to really explore that further after, either during or after school. So I went to Dr. Rosen's seminar twice because I loved it so much. And then now he does his own thing. But I learned so much there, and I love cranial work for babies, well, for everybody. But being able to work on their cranium and those sutures and release the tension there is like, for me, imperative. Like I feel like I can get such a better adjustment, like full adjustment on these babies, especially like here when we're working on babies mostly with latch issues. Like that's so important. Like especially when I go into...
Do you have a little diagram, the skull there? Because people may not know what a suture is.
Oh, okay. So, like when babies are born, well, let's just like, if they go through when they go through the birth canal, you can see on this little skull, don't mind the jaw missing, all these are called sutures. Like people know the soft spot. So that's part of the cranial sutures. And so when they come through the birth canal, all those sutures overlap. And then once they come out, it releases. And it's very stimulating to the baby. And it allows for kind of an unwinding and a stimulation to the brain development. And it's so beneficial. So when they come out too fast or too slow or via C-section, whatever needed to happen in that birth, it can affect the cranium, which in turn is going to affect so much, especially developmentally. And then we're looking at plagiocephaly or misshapen heads, offset sinuses. For example, one of my favorite things that I always ask patients on the new patient appointment is, does this baby have a goopy eye? Does it have an eye that tends to get crusty? Does it have one that they squint a little bit more, not open as wide? And they'll be like, oh yeah, but yeah, it's fine. The doctor, if they're a little older, they'll say, the doctor, our pediatrician said we'll explore that later. If the eye's not draining, we can talk about a stent put in to help the eye drain. And I'm like, oh, no, we can fix this in 2 adjustments. Because that's usually just part of their sinus, which you can see these sutures, here, all these bones connect. They make up the back wall, in the eyeball, of those sinuses. And so when we release any tension specifically in this area, it allows for the drainage to happen and allows for the symmetry to kind of come back to normal. And that one I love because, especially people who are not familiar with chiropractic care, that's a 1 to 2 adjustment fix usually. Now, obviously, I can't guarantee that in every single baby I see, but usually that's happening fast. We release that tension and the eye drains. So that one's a really fun one. But when we're talking about other sutures and other areas of the cranium, we've got cranial nerves that sit underneath the skull, in this occipital region is what it's called. And 2 of those nerves specifically control tongue movement and control the tongue. So that suck, swallow coordination. So if this is not functioning properly and there's what we call subluxation or misalignment at the base of their skull connecting to their spine, that could literally be affecting the nerve control to the tongue or the nerve communication to the tongue. And so it's not functioning properly.
Yeah.
And so when we adjust that and release all that, their tongue starts moving
That
properly.
must be what I must have experienced on that day that you were, I was like, the baby's suck is so disorganized. And then you adjusted him and the suck came so much more coordinated. Now, the interesting part is when you're adjusting a baby, it looks like
Nothing.
nothing.
Yeah.
Maybe I don't even know. maybe even less than a baby massage. So I was like, wow, this is a hard, like, okay, fine. In my brain, I know that it can help. I don't know how, and I don't know how to explain it to my clients.
Yeah.
So then having you physically here, what ends up happening usually in our waiting room is we have these impromptu type clinics with our patients, and we talk about all the random things that come up in parents' lives with babies being constipated, microbiome stuff, breastfeeding stuff. And then some of those things, I put my lactation hat on and I have my 2 cents. And then you put your chiropractic hat on. And so we're always bouncing ideas and knowledge back and forth to each other and looking at pictures of what is a tongue tie, what isn't a tongue tie based on what's happening with our patients. And when Dr. Palpin comes in and stops by and we're trying to prevent a procedure, which I still don't understand for the life of me, why he has me in his office when I basically am there to say, let's try something except surgery. And he's like, yeah, let's do that. Like, who does that except for Dr. Poplin? I don't know.
Yeah.
But if it's very necessary and a release needs to get done, we will do it. But we really like for them to work out the tension first. And maybe could you chat a little bit about, we've done some case studies together. Actually, I think 2 of the case studies are in this issue, in this magazine. Because my first original question was, people don't know what sutures are. What are sutures? And you just happen to go on and answer other questions like, what are some of the things that people may not realize chiropractic care can help with in their babies? And one of those things is goopy eye, like what you just talked about. But another one that I think people don't realize is when babies have that nasal congestion that's not related to like a cold or an illness. And can you talk a little bit about maybe that one? And if there's anything else like, you're like, oh, most people don't know that chiropractic care can help with this other thing. Maybe you can speak on that.
Yeah, it's the same with adults too, with the sinuses. Like the sutures are related to the back wall of our sinuses, which people think sinuses and they think
the front
your
of the
nasal
face.
cavity, but it's all these pockets in our head, essentially. So when babies, specifically, we'll keep on babies, but if their cranium is not even, and also most people don't know that the cranium flexes and extends. And it creates this pumping mechanism. And like you can't see it, but it's happening because that's what causes the cerebral spinal fluid that coats and nourishes our brain and spinal cord and all that, and our nerves in our spine. So the cranium flexes and extends, and then it pumps that fluid down through the spine and the spinal canal, and then the sacrum pumps it back up. So it can't stay stagnant because stagnant water is not good, right? So that's that cranial sacral relationship. But if that pumping is not happening well, and that flexion extension in the cranium due to tension, it can affect the ability of the sinuses to drain. Does that make sense?
Yeah.
I don't know if I'm like explaining it too complicated, but essentially we want to reduce tension along all of these lines, these sutures, so that the cranium can flex and extend properly and allow for that. And then we can go a layer deeper, I guess, when we're seeing babies, and so many babies nowadays with misshapen heads. And one thing I'll always look for with these flat spots is, where are the ears? So when you look down on a baby,
you're looking their ears from the top down, you mean? Is that what you mean?
From the top down. So the baby's like in my lap or I'm behind the baby. I'm looking where their ears are because they should be even on both sides of the head. And often with these flat spots, you'll see one ear
forward
way in front of the other. So that automatically tells me like they've got some restrictions. They've got cranial tension, probably torticollis that led to this. But I know for a fact that those ears are not going to be, so this is going to be a problem, as they get to toddlerhood. Their ears are not going to drain. And we're looking at potential for lots of ear infections.
Got it.
And things like that. So that's all part of that drainage. So if I see an eye that's bigger looking or squintier, even if it's not goopy, I know that there's imbalance within those sinuses. So the ears and the eyes are what I look for every adjustment. Every time I see a baby, I'm looking, what do the eyes look like? What do the ears look like?
Okay.
Because we need to keep on top of that.
So if I'm like a lay person and I'm just listening to this, right? What I'm hearing you say is that we may not realize it, but underneath the surface of our skin, right? People think there's skin and bones. That's what they think of. But there's also this what's the word? Like, there's a system of fluid and balance that's happening like in between the skin and the bones. And that's where you would think of things like cerebral spinal fluid or spinal fluid. And
like the fluid that sits on our brain and our spinal cord.
Right.
And it's what carries all the nutrients to the brain and spinal cord. But it needs to keep flowing. And that happens through the pumping of the flexion extension of the head, all these cranial bones, which even happen in adults, even though these sutures fuse, the cranium still, even as adult, flexes and extends. So that creates that pumping down, and then the sacrum pumps it back up.
Got it.
To keep things nourished. And so when I see an adult and they're like, yeah, I get like 3 sinus infections a year. I'm like, cool, we're going to do some cranial adjusting on you because that tells me that you're not pumping correctly to get that sinus drainage.
Okay. Yeah. And I'm really blessed because I have Stephanie in the office here with me and I get adjusted all the time for my neck and sinuses and headaches. So it's been really, really helpful. Yeah. But imagine a baby who can't tell you what's going on with them. So I just thought that was really fascinating. And what I didn't realize is not all baby chiropractors do this, right? Like the cranial sacral release technique is not something everyone does. Mm-hmm. So we're really lucky that our babies get that benefit. And I'm really lucky I get that benefit myself. Speaking of which, I forgot to get an adjustment today. Damn it. But so I think that part is fascinating. Tell us a little bit about what kind of a training does a chiropractor get? I don't know if people maybe, is this like, oh, I go to school for 2 years and I'm a chiropractor. I go to undergrad and then I go to doctoral school, or what is that all about? And then it sounds like after you do your basic training, then you have to go get additional training to learn how to do sacral release technique.
Yes. So like cranial adjusting, cranial work, cranial release, whatever you want to call it, is not really, well, I went to Parker in Dallas, so I can only speak for what they taught us at Parker. But I had to go to office hours to really hone in cranial adjusting because it was like one piece of one trimester for that. But overall, chiropractic school is 3.5 years.
Do you first get your undergrad?
Yes, you have to have a bachelor's. You can finish your bachelor's in chiropractic school in the first bit of it, but most people have a bachelor's and there's like prereqs. And it's very similar to medical school. The curriculum is actually almost identical with hours and everything. The curriculum part of it, we just take actually more neurology, more anatomy, more physiology. They take more pharmacology, toxicology, pathology. Like we have very little in that because we don't prescribe. Like we're just focusing on the body and making the body function. Whereas they have to learn more about like diseases and things like that. So the first, like the curriculum part of it, hours, all that, almost identical. And then the difference ends up when you start going into like residencies, right? So with chiropractic school, you have a year of internship. And that's it. I mean, not that's it, but you're working hands-on the last year where they have like long residencies and years and years and years of specialization there. I was very lucky in chiropractic school. I had the opportunity to go do the last half of my internship at an actual family practice in Colorado. I had to apply for that. And thankfully I knew these doctors and they were willing to fill out loads of paperwork to get me to come there. But I wanted the family practice. Like I wanted experience working with peds and pregnancy and postpartum, which is a lot of what they did at this practice. Whereas if I'd stayed at the clinic at school during my internship, I wouldn't have gotten any specialized training there. So I was very lucky that I had that opportunity because not everybody got the opportunity to go to a private practice for your internship. a lot of us had to stay at the school clinic.
Got it. So 4 years of undergrad and then about 3.5 years of school after that, plus a resident.
It's 3.5 years though, because it's trimesters.
Okay.
So it's pretty much straight through. You had 2-week breaks in between each trimester.
Okay. You're not like having a whole summer off. Okay.
No,
got
no
it.
Summer off.
I will tell you this. So one of the questions on the lactation side of things that I get asked from other lactation consultants, one of them, I guess the question is, how long should it take for this baby to respond to chiropractic care? And I know that question is super, now that
very
I know.
Loaded.
Yeah. Well, now that I'm on this side of the equation and I see what all goes into caring for these babies, it's very individualized. So maybe one baby takes 2 or 3 visits to respond really well. But I want us to spend some time talking about, that drawing that's on the wall, that where your table is, there's a drawing on the wall and it talks about like correction phase, maintenance phase. I don't know what it's called, but maybe can you speak a little bit to that? Because people sometimes think some chiropractors want their patients to be under chiropractic care forever.
Yeah.
And I think we do things
in an ideal world. Yeah.
Yeah, it would be great. I mean, I am a testament to that. I get adjusted, once a month for maintenance, but you don't have to be in chiropractic care forever. But can you maybe speak to what a care plan could look for on a baby, and should someone expect results at the second visit, or maybe speak a little bit to that so that a lactation consultant can know.
Yeah.
Because sometimes they're sending them to the chiropractor for 1 visit or 2 visits before they have a tongue tie release, when maybe we might want to see them a little earlier.
Yeah. So one thing for sure is like chiropractic is not a one and done, no matter the patient. It's not like, I went to the chiropractor, which I will get a lot. I don't say a lot, but over the last 10 years, I've been in practice for 10 years. It's a common thing to be like, I tried chiropractic, it didn't work. And I was like, okay, like how many adjusted? And they're like 2. And I'm like, well, you don't work out twice and get a 6-pack. Like, come on. This
I
is
love that.
This is a physical type of healing. It's not like when I get a headache, or when I used to get a headache, pop a bunch of Advil and it goes away within an hour. Like magic. Chiropractic doesn't work like that every time. Like that one baby that I saw with you, yes, that baby had a really instantaneous response to that adjustment. It doesn't often work like that. Every adjustment builds on the next. So, I mean, I would give the expectation of like 10 to 20 adjustments. And I know that sounds like a lot, and it's not like all of them out within the months. But yeah, like it takes time. And it depends on like how early I get to see the baby. A lot of people are like, it's not safe, so I don't want to adjust my baby when they're only a few days old. And I understand the hesitation. But chiropractic for babies, if you're going to somebody who's trained and knows what they're doing, is so safe, it's so gentle, and it's so beneficial if they've got something going on early that we see them as soon as possible. Like if they're having problems latching, like I saw a 3-day-old baby today and responded so well.
I know. That was so cool.
That baby was not opening their mouth.
That's another big one. Small, we call that in the lactation land, has a narrow gape. So they respond so well to lactation care. And I think it's fair to say the earlier we can see them, because you don't have as much muscle memory. Like when you're 3 months old already and you've been living your whole life in a position where you're arched a little back, right? Like the baby kind of lives with the head kind of trying to reach its butt, like a little arched back, or maybe shoulders up in the ear and a little torque to their neck.
Yeah.
That's going to take kind of a lot to get that baby now aligned and unwound, right? But if we catch them really nice and early, they don't have muscle memory. They're kind of like jello. And we can build some positive habits with the parents and do some exercises at home. I noticed those kiddos really take off amazing, and they have great feeding outcomes also. compared to those who come in later, you know?
Yeah, it's definitely easier to build the pathway earlier for them to follow than to like divert that pathway back to center after it's been going to the right for, you know, and for like a physical.
Maybe can you tell people what to expect when they were to come? Like if we're working with the way we do things, I don't know if people understand maybe like the visits are pretty, like when you say like 8, 10, 12 visits, we might do 2 visits a week for 6 weeks or for 4 weeks, but they're pretty quick visits. But tell us a little bit about what a person should expect with their first visit and like how we do things with the scan that we provide. Because I think that's really cool for people to see. There's some objective information that we gather so that the parent can see where the tension is. It's not like something they're just trusting us on.
Right. And that's another thing I really, when a parent hands me their child to take care of, it's a huge honor. And I want them to feel very comfortable with everything we're doing here. And if they at any point are like, wait, I have a question, like I want to honor that. So when you bring in your baby, we're going to talk pretty extensively about the history, like starting with conception, how the pregnancy went, how the birth went, anything along the way. And then we talk about how things have been since birth. And we really deep dive into that. And I ask questions that a lot of times, like about the goopy eyes and about, I don't know, things that parents are like, well, how is that related? And then I can explain that. And then I'll do a physical exam. So we take the baby down to the diaper and I look at muscle tone and I have the parents literally put their hands where my hands are. When I have something to show them, I'm like, feel this. Like, this is not what I want to feel. Like, we want this should feel like this, whereas right now it feels like this. And that's usually with like muscle tone and things like that, because I want them to see these things. If they're like, oh yeah, they don't have a side preference, and then I test their range of motion, I'll be like, do you see when I turn the baby to the right, how their shoulder is following? And point of things that stretching the arms above the head. If I've got a baby that is like resisting, or this arm comes up, no problem, and this arm is like tight, that is pointing to tension on their spine, specifically their upper neck. And then once I perform the adjustment, I'll do a pre and post. And often we see, those are like those measurable things that they can see during the adjustment, so that they're like feeling confident that this isn't just like some kind of like kooky thing. And then what we do before the adjustment, so after the physical exam, before the adjustment, or maybe before the physical exam. Actually, I do the scan first, because it's a temperature-sensitive scan. So if I'm touching them a bunch, that could skew that. So I do the scan first, and tell us what the scan's all about. Yeah, it's a very non-invasive. It's taking the temperature of the spine. So it's looking at the temperature on the right and left side of the spine, and we're looking for temperature swings. So if one side is way hotter than the other or way cooler than the other, we know that the body's not regulating correctly in that area. So it's telling us it's stressed in that area. And so what's really cool about the scan is, depending on what's going on with the baby, I can often say, I'm predicting to see stress in these areas. So like if they're like, my baby has torticollis. So they're turned and tilted. They have side preference. Often they find the side preference because they only like one boob to nurse on. And so I'll be like, cool, I'm expecting to see stress at the top of the neck in this scan, because that's controlling this and the cranium, all that. If I have a constipated baby, I'm like, I'm expecting to see stress towards the bottom of the spine, because that's where the nerves that control digestion are. If we have a refluxy baby, we're often seeing it between the shoulder blades, because that's where the nerves of the stomach go. And like 9 times out of 10, I'm right. So we'll see that stress. I'm like, remember when I said it's going to be here, here, and here? That's where it's at.
Okay. Got
and
it.
then it's very visual, because again, with babies, they cannot tell us how they're feeling. They're just showing us. They're showing us the decreased function, decreased sleep, decreased eating, decreased pooping, those kinds of things. So when we can see it visually on a scan, like something measurable, especially dads love the scan. they're more numbers kind of oriented. And then when we, along this care plan, we'll rescan and we'll see the changes. And that's really cool. And that's just another way to like emphasize that this is working.
I have got to tell you, first of all, I'm just going to keep it real because that's the only way I know how to be. And it's not PC. I don't really care. But first of all, last month, I didn't record a podcast episode because I was like, I only like to record podcast episodes on things that are really, that strike me, like that are really interesting. And people contact me and they want to get on my podcast and they have like some sort of like, whatever, like postpartum thing or whatever they want to talk about. I'm like, that's so basic. I don't want to talk about that. Or it's like, everybody knows that already. It's not that interesting. And I'm super biased. It's just, I'm going to talk about what I feel like talking about. That's why I have my own show. Make your own show if you want to talk about that. So that's where I come from. But what I will tell you, 6 years ago, I'm wearing my nurse hat first. And I'm like, all these things can be resolved with clinical interventions, right? So your baby has an ear infection, it needs amoxicillin. Your baby has goopy eye, put a warm compress on it, and like, I don't actually know what to do after that. It's not, that's not my job is to diagnose those things, but that's my frame of reference is like, talk to your pediatrician, they'll figure it out. My job is to make sure there is milk being made by your breast and that your baby is able to remove it from your breast and consume it. And that's it. But what I noticed is that's not always the hardest thing. The hardest thing is all these peripheral things that are happening in a mom and baby's life that affect feeding. And some of that is not in a textbook. So what I mean by that is babies who are having difficulty sleeping and what someone would call colicky. And you're like, well, why are you colicky? What's going on here? A baby with a side preference. And they're nursing and the mom's like, it really hurts on one side, but not the other. Babies with arching of their back and they don't think they have like a clinical type of reflux, like no esophageal erosion, like no acid kind of coming up where it might need medication. But this is a baby who lives kind of with his chin up and back and the back of his head kind of trying to reach his bottom. Babies who are constipated. And when I say constipated, like that's a little bit subjective in the baby world. I've had patients tell me their pediatrician said it's okay for their baby to poop once per week. It's probably not a good idea for them to keep waste product in their body that long. And the baby looks... Yeah, you have a lot to say. But I'm just saying for people who are listening and other maybe lactation consultants, I've been so struck with such great outcomes because I don't think you become a believer until you see repetition. Because sometimes like, that was a fluke. Like, okay, that baby responded well. That was probably just like he grew out of it and it happened to be the chiropractor's taking credit for it or something. I'm really jaded like that. But in this case, like
Honestly, me too.
I've seen so many babies, constipation, reflux, colic, eye goop, difficulty feeding, side preference, flat spot of the head. And they're just like, their parents are like, wow, this is a non-medication. It's like a natural way for us to help heal your baby's body. And then you have the things that you do to help with things like constipation. But then also in conversation, I hear things that the patients are saying. I'm like, oh, this probiotic might be a good match for you. Or talk to your lactation consultant about this. And so together, it's kind of cool to bounce our expertise and then our patients get the best of both worlds. Because I feel like one of the saddest things is how women now or postpartum moms and babies have a lot to contend with on their own. And I feel like sometimes their concerns aren't really heard if there's not a medication to fix it. Does that make sense?
One of the babies we saw early on, when like one of our first Milk Diva patients together, I remember the dad, and I love millennial dads because they're so involved. It's amazing. And they advocate for the wives and they advocate for their babies and they're willing to show up to these appointments and ask the questions and it's not just up to mom. So I love that. But this dad was like, we keep being told because this baby, there were so many, like he had remember his skin was bad. I'm not going to say the name of the baby because that's, but he had horrible skin. He was always distraught, so tense, bad latch. I mean, out the wazoo, stressed out baby. And because he was gaining weight, I think the pediatrician, and no hate on pediatricians, but they just didn't know. They're like, he's hitting all of our checks, so he's fine. You just got a cranky baby. Sorry. And the dad was like, I'm not accepting that. I'm not accepting that they're telling me that he's normal and fine. And you and I, we looked at this baby and we're like, there's some stuff going on.
Yes.
We had to fix the diet. Come to find out what he had a really bad dairy.
Yes.
And those a lot, very common. Remember his skin cleared up with that. But so much helped with this baby, functional milestones. And they would have never gotten that if they hadn't taken a leap of faith.
Yeah.
And come to see a chiropractor.
Yeah. And one that specializes in babies, because that's really, really important. I think the thing is, what was explained to me once is compensation versus, what's the other C word? Compensation versus, I can't think of the word now, but your baby can compensate, but only so long. And so if they're compensating in one part of their life, like digestion, they're not going to have reserves left to compensate for immune health, let's say. So we're really trying to set them up so they don't compensate versus competent. So we don't want them to be learning how to compensate. We want them to be competent eaters or competent movers, right? Not because they are, because whenever you're compensating, you're adding a ball. If you're juggling, it's here's another ball to try to juggle. And eventually something's going to drop. But if you can kind of knock out some of those stressors in your baby's life before they're set in with muscle memory and things, then those babies can thrive a lot better. And what that looks like, what thriving means is, now you're not using compensatory things. You can sleep better. You can poop better. You can learn how to roll over at the right time. You can rock and crawl and then start walking nicely without having dragging your foot or scooting or things like that. And that's been kind of cool to learn how it all ties together. And I've become a huge proponent of chiropractic care, but I don't know that they're all made equal. So how would you tell someone to search for a chiropractor for a baby?
ICPA. Is usually where I tell people to go. It's if they're we're moving, I'm okay, research the ICPA, go to their website, and there's a link that says find a chiropractor. So anybody who's a member is usually keeping up with training. Anybody who's Webster certified, which is the technique for adjusting pregnant women, is usually competent in children. Not all the time, but those two things. So look for a chiropractor who's a member of the ICPA, and then look for a chiropractor who's Webster certified.
Okay.
And then if you go to their website, the chiropractor's website, and it's all about kids, and it's probably a good a person to go to.
Yeah.
I wouldn't go to a PI clinic.
Right.
And be can you adjust my baby? Right. I want to go to sports chiropractor and be adjust my baby.
And PI stands
not saying that they're not competent to do that as a sports chiropractor or a personal injury chiropractor, but that's not what they're specializing in. And I wouldn't take my kid to a surgeon for a pediatric visit.
Sure. Sure.
So there's specializations.
Yeah. And if, today on today's episode, we just jumped into kind of some more talking a lot about cranial work and Goopy eye and nasal stuff. And we were a little bit more specific today, but if you guys want to learn a little bit more about chiropractic care in general, episode 5 and 6? Episode 4 and 5 is all about breastfeeding and chiropractic care. And I interview there Dr. Aurélie Petitclerc, who's a doctor of chiropractic care out of Europe, and she's amazing. And so that's a little bit more if you want a fuller version of chiropractic care and how it can help, and a little bit more comprehensive. But I wanted to just dive deep into some of these cases that we've been seeing and how impressed I've been with their outcomes. But I will say what's interesting is we also have had some phenomenal prenatal and postpartum cases of people. Like we have one patient who's a professional violinist, and she was not able to, she had so much pain in her like shoulder and arm, and it was radiating down. Maybe tell us a little bit about that. And then we have the other patient who just recently found out she was pregnant, and she went to quite a few people and couldn't get better. Do you remember that one?
I think
she just left her work. She doesn't have to, she's not at work anymore. It's okay.
I don't know.
Tell me,
I'm sure I'd be like,
well, tell me about some of the things that like our moms come in for, because we're taking care of our babies, but we need to take care of us too.
Yeah. Well, I love taking care of pregnant women because, you know, a lot of the pregnancy symptoms, again, from the OB side, and again, not hating on OBs or anything, but they're like, oh, well, I can't help with that. If it's sciatic pain or whatever discomforts, pubic, lightning crotch, all those things that an OB is going to be like, you know, you're pregnant. You deal with it. Like I've actually had moms tell me that their OB told them to deal with it. And for me, I'm like, that's not a good answer. And I've seen the difference. Like even we adjusted a pregnant woman today, and she was waddling, and she was not waddling afterwards. It's so important. And it's so important because it affects the baby. So if your pelvis is all out of whack, that's the bowl that the baby is being held in. So if the bowl's like this, that's not as nice as this. And then, you know, the pelvis is not going to be able to open properly for birth. And, you know, I could get deeper and deeper, but I want a mom to enjoy her pregnancy to the best possible way. And I want her to have the best birth outcome. So chiropractic, for obviously the chiropractor, I'm biased, but I feel like every pregnant woman should be able to have access to chiropractic care because it can be so night and day difference.
Yeah.
And I have so many second-time moms come to me, you know, the first time they had some kind of birth trauma or horrible pregnancy or something, and they're taking a shot in the dark on chiropractic. And then it's like, I wish I'd known sooner. I wish I had been here for my first pregnancies. I wish I had known that this was safe.
Yes.
And that is one thing I will say, because I've had a lot of moms come to me after going to other chiropractors for prenatal adjustments, and they're not prenatal specialized. Not to say they're not a good doctor. It's just like they're not trained in this. And there's very subtle differences between adjusting a pregnant person and a non-pregnant person. And I've had moms, one of my favorite patients, I've been seeing her for 4 years now. She called me when she was pregnant with her second and was like, what are your prices? Do you take insurance? And, you know, I told her, and she was like, you know what? I'm going to just keep going to my other chiropractor because he takes my insurance. And I didn't. And I was like, totally fine. I respect that 100%. If you can use your insurance, use it. If you trust this guy, absolutely. He ended up spraining her pelvis. And not because he's not a bad, or because he's a bad doctor. He just didn't understand the person in front of him, pregnant, relaxing, the hormone. And yeah, so she called me after that and was like, well, now I'm injured. Can you adjust me? And so, yeah, as the story goes, I see her every other week.
Yeah. I think the coolest part, which I didn't know too much about, was the pregnant patients that come in here are the best, because then we see them postpartum and they have such great birth stories too. Like it turns out so great. And so I didn't know too much about the Webster technique, which is a technique that sometimes can be, well, maybe I'm saying this wrong, but I know that chiropractors that are Webster trained, a lot of the adjustments can help so that the baby can be in the right position for a vaginal birth. Yeah. And so we've had some people come in and be like, hey, my baby's breech. Can you guys help me with changing position? And you always say, we don't turn babies. We don't turn babies. But can you go on to explain how chiropractic care can help babies who are malpositioned, who are maybe breech? Because we've had quite a few patients who come in here and their babies are breech, and then you work with them and we're able to get them in the right position. Or more importantly, we work with patients earlier on, like 20 weeks of pregnancy, and then their babies never, like they're not breech. They just stay in the right position.
Yeah. So the biggest thing to know is like babies will be in the right position for them at that time. So they're very intelligent in that way. Babies are super impressive, and I can hear and a recent experience about that you know about. So with the Webster technique, what we're really honing in on is the pelvis, is the sacrum, which is the triangle bone at the back of our pelvis. And there are ligaments that attach from the sacrum to the uterus. So if the sacrum is stuck or not moving properly, it can create tension on
I think you have a picture on the wall. That picture that's in front of you, if you look to the front left, I don't know if that little...
Well, it's going to be really bright for a second. Right
Yeah.
That one?
Yeah.
Yeah. So, can you see me?
Yep.
Okay. So sacrum here, this bone, very important, attaching to the uterus. And then we've got these ligaments here as well.
Those are the round ligaments?
Yeah, that's the round ligament.
Okay.
And then the pubic bone.
Okay.
So the pelvis, sacrum, pubic bone, very important to adjust during pregnancy, because that's creating the tension or non-tension in the space for the baby to grow. And so if there's tension there and misalignment there, it can create intrauterine constraint. And then the baby's going to be like, well, I have to figure out where I can be. And that's when they turn into wonky positions, whether it's breech, transverse, what is called asynclitic head, when they're like sitting like this and they try to come out in birth like this. Not good, not ideal. So if we can adjust that sacrum and do soft tissue release, especially on those round ligaments on the front, adjust the pubic bone and allow all that soft tissue and to be released and all the pelvic joints to be adjusted and in alignment, that releases all that tension and allows for the ultimate optimal amount of room for the baby. And then they'll want to move into that head down position, because that's the ideal position for birth, because the pressure of the head on the cervix is what starts dilation.
Yes.
So if there's tension there, either keeping the baby too high or in a weird position or breech, we can affect the environment, but we can't affect, there's limitations. Like, I'll share an amazing patient of mine. She just had her 7th baby, and she's had 6 home births now, and this was her first breech baby out of 7. So we were like, why? You've been well adjusted. You've been adjusted weekly for nearly 2 years. So it was really strange to be like, why did your baby breech? So we were like all hands on deck. Dr. Ellie Goodwin helped. She did acupuncture and adjustments on her. Dr. Carissa Demara, she did adjustments and work on her. And me, obviously, I'm her main chiropractor. And this baby wouldn't turn. And we were like, I was just like, okay, babies know what the best position is for them. There's something going on. There's got to be. Like, my guess is the cord is wrapped around her neck in a way that wasn't allowing her to turn. And I'm not like, do what makes you feel safe, but she has severe medical trauma and hospital trauma, so she did not want to go to the hospital. She ended up having a breech birth at home. Everything went well. Everything was great. And the baby had the cord wrapped around her neck 3 times.
That's why she couldn't turn.
Yeah. So super cool to be like, that baby wouldn't turn for a reason.
Got it.
And, we stayed out of the way. We did everything in our power to allow for her pelvis to be in the best position to birth this baby still. But had she turned with the cord wrapped around,
that would have been bad.
Like, who knows what would have happened?
Yeah. That is so fascinating and interesting. And it's been like, I want to make sure we're not scaring people with the story of the cord around the neck. But I'm going to tell you, like, this is real life. And I love that chiropractic care is safe, because you're not physically going in there and physically trying to turn this baby, but you're doing all of the things so that naturally the baby's going to get in its optimal position. And in that case, the safest position for that baby was exactly the way it was, which was breech. I just have been so impressed because a lot of the girls who work here, like in this building, in this office building, have been our patients throughout their pregnancy and postpartum, and then like with their babies. And like their births are amazing and their feeding experiences are amazing. And I'm going to tell you, I'm kind of like that person who wasn't that big of a believer, who was such a believer now. Yeah. And I just wanted to share that the amazing work that you do with our community. But I also just don't think people really realize the stuff about like birth and positioning in chiropractic care, or like things like the Goopy eye, or like sinus stuff, or ear infection stuff for babies. And then you did touch on cranial sacral release technique, which is something that is harder to find in a chiropractor, which can, I think, make a world of a difference. And we're really lucky to have. There's only a few providers in Austin that do that, and it's very hard to find them. But coupled with your experience, because you also had been a birth doula in the past, you're really connected to the birth world, and you're very compassionate and empathetic. You also do a great job of providing recommendations for supplements or electrolytes, and you don't sell them. You just tell people, this is what I think is good for you. You can get it on your own. I'm not making money off you in that way. And you just have like a genuine heart for people to feel, to thrive and to feel at their best. And you're very nurturing with them. So I just wanted people to know how great you are and how special the work is that you do.
You know, I think it just helped that I have 4 sisters. And while I was in chiropractic school, like I went into chiropractic school thinking like, oh, I'm going to focus on sports. I don't know why I thought that. But during the 3.5 years that I was in chiropractic school, I had a bunch of my sisters had babies, and I saw what they went through. And I was like, I want to help them, like women, like my sisters. And like all my patients, like know if they know me, they become like my friends. Like we're friends. With the village, we're all like supporting each other as moms. But being able to help my sisters, like one of my sisters, her 3rd pregnancy, she had an unmedicated vaginal birth. Like, and their first 2 were not like that. My other sister, she had her 2nd baby in my 1st year of practice, and I lived with her. So at that time, so I got to adjust her weekly at least. And she ended up having in her 1st pregnancy, and not the one I took care of her during, but her 1st pregnancy, she ended up in an emergency C-section. It was extremely traumatic for her. So the 2nd one, I was like, we got this. Like we're gonna help. She chose to have a birth in her birth. Wanted that VBAC. And during chiropractic, I did train to be a doula, and I did pro bono doula work for a mother's home in Keller, Texas. And that was such a cool opportunity. But so I got to be my sister's birth doula in her 2nd pregnancy. She had a successful VBAC, and just seeing the difference that chiropractic care made for her was amazing. Yeah. So that just kind of like grew my passion with my sisters. Yeah. So they're the reason I do what I do.
That's so awesome. And I like that, you know, it's a low cost thing. It's not like I'm spending $200 a visit. It's very, I think, affordable. And a lot of the times insurance companies do pick up the tab for it when you send in like a super bill or something. So I love that. In the show notes, I am going to put a link to this magazine article so people can read the full article. And I'll put a link in if they wanted to book an appointment for chiropractic evaluation with us. But I appreciate you spending time on a Friday evening sharing your knowledge with us. So thank you so much. I really appreciate it. Our patients love you. We love you.
Thank you.
Well, have a great weekend. Thank you so much for chatting with me, okay?
All right, bye.
Thanks for listening. To learn more about newborn feeding and get your free swipe file, visit milkdiva.com/newborn feeding. And if you've ever said, wow, I wish I would have known that while you're listening to this podcast, then help a friend out and share this podcast with them. You can also help us by leaving us a rating so more people can benefit from finding this podcast. Medical disclaimer. Please know that all opinions expressed on this podcast are solely my own and not intended to substitute the advice of a medical provider. I am not a medical doctor, and all information shared is intended for your general knowledge and is geared towards full-term, healthy singleton infants and healthy, low-risk pregnant or postpartum women.